Good morning, everyone. First of all, I would like to thank the organizing committee, especially Dr. Jagishan, to invite me to speak on this. The topic that I am going to discuss today is on art automation and the role of artificial intelligence and what's the future hold for this particular field. There is nothing to disclose. If you look at the first test tube baby, that is Louis Brown, that uh, who born 43 years ago in Oldham, Cambridge. She was born on of the simple culture system and a small incubator that she's holding in her hand. If you look at around 2 decades ago, the IVF laboratory were kind of small rooms with a incubators that we adopted from the cell culture or tissue culture laboratory, a small horizontal laminar flow and few equipments. But the modern IVF laboratory has totally changed with a controlled environment, with a lot of clean room technology for better pre-implantation embryo development and culture to the day 5 or day 6 of embryo development. And also, if you look at the live birth rate of IVF back in 19, starting from 1980 to 1990, it was only 6 to 10%. But now you can see it has gone up to 30 to 50% in some of the best centers worldwide. When you look at the IVF whole process, starting from the selection of the clinic by the patient to ovarian stimulation to the embryo transfer or the pregnancy outcome, there are multiple steps or processes are involved with a lot of variables in between them, especially the IVF laboratory process has got more than 200 variables involved in that. And we know that there are a lot of limitations to the IVF treatments, especially with related to the accessibility by the patients, affordability of the treatment, whether it is affordable to the whole population. And you know that it is a very multi-step procedure involving a lot of complex procedures sometimes involving when it involves the third-party reproduction or the pre-implantation genetic testing or the other complex procedures. And we all know that it is very labor-intensive procedures and very technically challenging steps involving many highly skilled professionals in the IVF laboratory processes. And when we look at the in vitro fertilization, with increasing demand, there is increasing demand, and you have to sustain the exponential demand for the IVF worldwide. And there is also need for a streamline the existing processes that involve, and innovations are inevitable in that two arenas. So definitely automation and the artificial intelligence has got an important role on IVF treatment processes to streamline them and improve the process flow. If you look at the search engine for the literature that PubMed, you can see the publication related to artificial intelligence or automation has increased exponentially in last 7 to 8 years. A lot of groups are working on this particular field. And even fertility sterility, the Journal of American Society of Reproductive Medicine came out with a special section on the in vitro fertilization a few years ago with some kind of expert visions and what happens to the IVF scenario or laboratory in another 7 to 8 years by 2030. So there is a lot of discussion going on worldwide, and a lot of startup companies investments are happening on this particular women's health arena for the betterment of the barren couples. When we look at the artificial intelligence, what's the definition? AI stands for in short, stands for the artificial intelligence, and it refers to the systems or machines that mimic the human intelligence or human brain to perform the task in a continuous manner or to improve, and it can improve it by themselves based on the data or the information they collect or that we give it to them. So the data is very important. The more the data you give the inputs to the system, it will perform better. In our day-to-day kind of scenario, we see the applications of artificial intelligence or machine learning in various areas of our life, like Facebook, the Apple phones that we use, and also the autonomous vehicles or driverless cars, smart homes or chatbots, chat GPT that came out recently, social media, several areas like the some of the OTT platforms like uh, the uh, the Prime Video, etc., Netflix, etc. They uses the power of the artificial intelligence. So let us look at how this artificial intelligence look, how the different type of machine learning. It's another area arena of artificial intelligence. So is the machine learning. So what are the different type of machine learnings that is used worldwide? One is known as supervised learning, another is unsupervised learning, and the last one is reinforcement learning. Reinforcement learning is mostly used in the car industry or autonomous vehicles, but let us look at the what is supervised learning. We know that when you teach the kids in schools or nurseries or primary, we give them some kind of basic data and they keep on learning and they understand, and later on they kind of identify the things with easiness and with a lot of confidence. So same way, when you talk about the supervised learning, machine learning platforms, so you need a teacher. So this teacher will kind of give the data. You have to give a data set with which kind of act as a teacher. And the role of this the trainer is to train the model or the computer or the machine. So once the model gets trained, it can make kind of some kind of a probability predictions or decisions when a new data is given based on the how it was trained, like what it is given. So in this scenario, like whenever you train with the data, later on you give us a set of items similar to the trainings data set. The system can predict with kind of some kind of probability, kind of a 97 or 96, depending on how strong the training data set that we have given. So most of the current or maybe the earlier version of the embryo selection tools or the AI systems were dependent on this supervised learning. So how does it work for the SEM analysis? Like if you want to train a AI system for the SEM analysis platform, like about a computer-assisted sperm analysis. So there are a lot of machine learning-based CASA systems are coming out or in the pipeline. How do they train those systems? What you have to do, like you have to give the machine learning platform or AI kind of different type of samples, patient samples, like video samples, like oligospermy, asthenospermy, normosospermy, teratospermy, or combination, whatever it is, or esospermy. And some expert has to teach the machine learning platform that this is oligospermy, this is asthenospermy, maybe around 10,000 samples. Then the system will learn and later on it can classify the output based on the samples that you give. When it comes to the unsupervised learning, there is no trainer. The model learns through observations or it finds the structural patterns. It could be data or it can be images. So like once the model is given a data set, it try to find some kind of a patterns and relationships in the data sets, and it creates some kind of a clusters around it. So basically it cannot give labels, or it cannot say apple or banana or oranges. It cannot say like that, but it can cluster them into three different types as you see here. And the probability kind of the giving accuracy of this kind of system is very high. This is what everyone sees in the Netflix recommendation when you log into Netflix, and if you are watching a particular type of movie, maybe action movies, maybe after 2 weeks when you log in again, it will give you recommendations for similar kind of movies. So that is based on the unsupervised learning integrated in the Netflix platforms. We can see another kind of, so basically this unsupervised learning is based on the no feature engineering. We can see another example. Suppose you want to teach a machine learning platform, a deep learning model, how to identify a runway, what you have to do in that particular scenario. So what you have to do is that you have to feed the system, the computer, with a different type of images of runway. And also you have to feed the system the different pictures, so that what will happen? It is not as a model training. The model sees the samples of Ranveer and not Ranveer samples and learns its own important features in Ranveer to identify Ranveer. So it's based on some kind of a particular kind of a features. It's known as a basically non-feature engineering or feature extraction. So the basically it uses artificial neural network or a conventional neural network to identify these patterns, and that way it can identify Ranveer or not Ranveer. So later on, if you give the picture of Ranveer, it can say with maybe 99% accuracy, this is Ranveer. So this is the no feature engineering kind of a platform that is used. So let us see, like if you are giving a different type of video images of seminal samples. So here what happens is that there is no expert. So instead in a deep learning or ANN network, it directly try to learn itself and classify the images. So the same thing is also utilized for the when in IVF scenario, when you have multiple blastocyst or embryos, and usually the embryologist choose the embryos. But if you have machine learning platforms with a no feature engineering machine, it will identify the patterns and it will classify accordingly, and it will select the best embryo for you to transfer to the patient. So when you talk about embryo evaluation, what really happens is that computer vision is totally different. Computer sees kind of a digits, like when you give a particular area or different areas of a blastocyst, that is converted to some kind of special digits, and it kind of make a different computer vision patterns. So that's totally different from what we see or a human brain sees. So you get a more information when you employ artificial intelligence platform to identify an embryo, choose the best embryo for transfer. When we talk about IVF treatment and the success of the treatment, you know that there is between the clinics or between the IVF programs, there is a lot of differences. It also depends on the experience of the doctor or the infertility specialist, the knowledge, the trial and errors, etc. How many years you have experience in reproductive endocrinology, years of IVF experience, etc. So basically, you can say the artificial intelligence now is acting as a kind of a physician assistant. It cannot replace the doctors or embryologists or the IVF professionals. So definitely it will give a lot of assistance. So what are the areas that the AI in the future or maybe currently being employed to assist the IVF clinics? It starts from pre-IVF. It helps the patients to find the best clinic. There is an AI platform to clinic finder platforms. Even success prediction, if you input the AMH value, the patient age or BMI, it can predict what are the success rate of that particular patient. Even for the ovarian stimulation, it can predict the what is the number of eggs that is available from a patient, or maybe what is the starting FSH dose required. But even timing of trigger has been tried out by the Boston IVF group, and there is a live for a particular company in the US or startup company. They are working on it. Even protocol selection, what is the best protocol for a patient, timing of antagonist start, risk of OHS, and when you talk about the embryo culture or IVF laboratory or embryo transfer, there is embryo ranking or embryo scoring, artificial intelligence software is available. Even automated Gardner scoring or endometrial preparation for the frozen embryo transfer, etc. You can take the help from the artificial intelligence platform. Even the scheduling or the data management, even key performance indicators and the statistical process controls for the IVF programs and labs. I will discuss a little about how we do here in our program, and we can get some kind of insight on that. So already there are some startup company working on this automated machine learning platforms for the diagnosis of infertility, and that help or assist a clinician making efficient and accurate diagnosis of patient with infertility. And there are algorithms to help in the frozen embryo transfer, and whether if you want to do IUI or maybe ovulation induction or maybe triggered, etc., it is already there. Even for folliculometry, there are some startups like one that is from Israel, IMA company. What they are developing is a small probe with artificial intelligence integrated in that, so that a patient doesn't have to go to the clinic. So they can utilize that platform or maybe that small device, toy-like device, so they can do the ultrasound themselves, and the report will go to uh, the the clinician who is a part of their fertility treatment, and it will give the doctor can titrate the dosage of gonadotropins and etc. for this particular purpose. When we come to the IVF laboratory, you know that IVF laboratory and embryology has to make crucial decisions when it comes to the gamete selection, sperm selection, oocyte selection for insemination, or maybe the embryo selection for embryo transfer, whether it is a fresh embryo transfer or a frozen embryo transfer. So it all depends on the experience of the embryologist or maybe the competency level of the embryologist in selecting the right embryo for transfer so that the patient can get a successful outcome. So let us look at the gametes, how the selection can help with some of the advanced platform. There are some already, there are AI-powered seminosis platform. Even nowadays, smartphone-based diagnostic platforms are available. That is on the, we call the point of care seminosis devices. And recently, one of the company, IVF 2.0, they have developed a computer software. It's known as SID for the sperm selection. Nowadays, so you know that ICSI, the embryologist chooses the sperm based on the motility or maybe the morphology, but that's a technician is selecting or the embryologist is selecting the sperm. And there is a scope like utilizing the particular the AI platform on this particular purpose so that AI can select what is the best sperm for injection. And this recent study they published shows that if you use that system, you get a better kind of fertilization, positive fertilization compared to the negative fertilization that found with a normal conventional selection, or better kind of blastocyst generation, the whisker plot that is shown here, that is statistically significant. And also, many of people among the audience may be doing the testicular sperm ICSI or maybe micro-TC or maybe especially when you talk about non-obstructive zoospermia, the identification of sperm takes a lot of time by the embryos. Sometimes takes 3 to 4 hours when you talk about the micro-TC sperm identification. So, what are the possibility of using machine learning, computer vision systems? So, recent some of the papers came out. They were looking at the some kind of machine learning scenarios where the system can identify the sperm so that you can reduce the time. The embryos doesn't have to spend time on identifying within a few minutes. It can locate or it can scan the whole dish and can identify and label where the sperm is located, so that it become easier for the embryologist to do the rest of the process. And there is also a lot of other small innovative devices also getting developed. This is on by one of the University of Melbourne group, microfluidic approach. You know that at a small scale level, many of you might be using the sperm, the microfluidic for the sperm selection, the sperm processing. But there is also work related to this on the testicular sperm isolation. So the study shows that there is a 36-fold improvement for the recovery of sperm cell in the initial study when they did to the sperm selection from the testicular type of samples. Another interesting device that is in development from Israel, a company known as Babies, is on the sperm selection. You know that IMSI was there for a long time, but it did not make its inroads heavily on the IVF clinics. There are several reasons for that, because some embryos has to spend a lot of time, and several Cochrane's reviews doesn't show much kind of improvement. But the inventors of the IMSI definitely says that, I mean, study shows that patients who have undergone a failed ICSI with oligospermia, etc., may benefit from the IMSI. But the disadvantage is that you have to spend a lot of time in ICSI. So this company has developed a system to automatically select the sperm based on the AI platform. And there is an automated ICSI robot, needle kind of pipette. It will select that sperm, like what you see in this particular video. The pipette will go automatically. There is no human intervention is needed. It will pick up the sperm, the right sperm, based on a high magnification, around 6,000 magnification, and it will keep it in a separate droplet. So the embryo has to go only to the ICSI station and pick up those good sperms that is already been selected, and just to inject into the egg. Another development that is happening is the IVF egg collection chamber, or EXCEL, by the Newcastle Group. You know that when egg pickup happens, a team of nursing staff, doctors, and embryos is necessary. But by this system, the embryo's presence is not necessary. Using the system, the egg pickup lab or a pickup suit can have the system, and the follicular fluid will go directly into the system, and it will separate the egg cell with this. It has got a controlled carbon dioxide at 6 or 5 or 6%, and it will separate out the egg cell and keep it until it is transferred to the IVF lab, and it will be in a physiological condition. So that's an interesting system where the clinics start very early in the morning in some of the places in the world. Another area of egg selection where this automated prediction might help is the egg cell selection, or oocyte assessment. You know that when there are several patients nowadays undergo the cancer fertility preservation or the social egg freezing. So one of the company, Future Fertility, developed by Dr. Dan Nayoth, they developed a system where after denudation, you can put your oocytes images into the ICSI software, or this Future Fertility software known as Violet, and it will automatically assess the quality of this oocyte, and it will predict what are the chances of getting live birth or blastocyst development from the oocyte. So before starting the freezing itself, you can counsel the patient what are your chances of getting a blastocyst from these oocytes. So based on that, maybe you can go for another round of stimulation for that particular patient. That's one of the good thing. And many of you must have heard about the recent news about the robotic ICSI babies that was born in New York. So that is one of the company by named Overture Life. They are developing a Piasso ICSI based, even a PlayStation, a video PlayStation based controller is used for this ICSI station. So by using that, the ICSI could be performed very easily without much human intervention. So very interesting works are going on in our field, especially when we talk about the microfluidic based systems, or maybe the selection of the embryos based on some of the metabolic or maybe proteomic samples that is being released by the embryo. So several things are going on in our field. And also we know that there is a lot of inconsistencies in the embryo grading when it is done manually by different embryologists. So when you use a machine learning based system, there is a high chance that you can select the best embryo for transfer. That is more relevant when you were talking about this time-lapse imaging system, because in that 5 or 6 days, millions of data points are generated in the time-lapse incubation system. And there are several companies who have come out with the embryo ranking or supervised learning based ranking system. Some of the studies have shown a very good concordance between the IDA score, like IDA score, one of the scoring system, non-implantation data scoring by the Vitrolife. Another is the Garner criteria, one of the commonest the blastocyst ranking system. So all these studies clearly shows that there is a lot of benefits using the embryo ranking system, and that could be become integral part of the IVF laboratory. Like if you do a manual scoring, it takes around 26 minutes per patient. But if you use an automatic scoring, it will take only 1 minute per patient for the embryologist. So there's a lot of functional or maybe process improvement can be integrated in the laboratory. And also, the some companies are developing the system for the optimization of biopsy and ICSI using an AI platform. Like nowadays, you take the biopsy just from opposite side of the inner cell mass, but the arbitrary scoring. Like now, the system can tell you exactly which are the areas of the trophectoderm that would be good for the best trophectoderm biopsy, or maybe what is the best area to inject the sperm in the ulama that will optimize the ICSI process. Another area that is also developing is related to the cryopreservation. You know that over the years, the number of cryocans are getting more and more in the IVF laboratory because of more of freeze-all cycles. So the storage is a big issue. And this storage problems is a big issue worldwide. So automated storage is also another area being explored by some of the programs. So another after all these processes in the machines and the processes, what is the important area that need to be considered is the efficacy of the data that you accumulate in the laboratory. So that also need to be streamlined. This intelligent automation is already being utilized in the industry or manufacturing sector for the autonomous decision making to avoid the human error, etc. One of the important area is the statistical process control that is widely used in the IVF industry across, especially if it is a network of IVF clinic. One of the things that is maybe of high usage or maybe of use is the utility of a Microsoft PowerPoint business intelligence or Power BI. We started using, we have two data scientists in our program. So with our 6 IVF clinics in New Zealand and another 6 to 7 clinics in Malaysia and Southeast Asian country, we are kind of rolling it out across so that we can assess the process and we can control the process in a nice way. Like if you see here, sitting at our on center, we can just find out exactly how the oocyte recovery rate or duration of OPU across the centers, and also the progression to treatment by each clinicians, and also we have a doctor scorecard, how many oocyte recovery happens and implantation rate or maybe progression, 12-month progression to treatment by each clinician, ICSI fertilization rate by clinic, or my total blastocyst utilization rate across the years and multiple pregnancy so that we can control that. ICSI fertilization rate by each individuals, like each embryologist, how is that's across the clinic, across the different quarters, that can be controlled, and you can see the key performance indicators in a dashboard, and that's the beauty of if you use this kind of automated intelligence platforms so that you can but for all these things to happen, this is kind of a traffic light showing that everything is in control. The green that shows it is in control, and maybe the arrow sign shows that whether it is 2 standard deviation above, 2 standard deviation below, so that you can start your troubleshooting process or you can start your root cause analysis. So IVF workflow, you know that there is so many things involved in that. So many of these areas you can utilize a machine learning platform, but definitely there is a machine brain is needed. For the machine brain it is thirst for the data. So each clinic need to have a software, a data management, a software or EMR. That's a must. That's a must for fertility clinics. I'm sure that with the new ART law in India, I think most of the clinics have started the fertility software or maybe EMR so that a lot of data will come in, and that will helpful. Without data, nobody can do anything on to integrate the artificial intelligence system in the clinics, and that's very important. Even there is some systems that people are developing on the traceability, data retrieval, KPI, putting all these things together. What are the process happens that can be entered into into your artificial intelligence system, and later on, if any kind of troubles happen, you are getting low implantation rate, or any other issues that can be identified easily by using these systems. But what I like to say at the end is you have to look at all the system based on the Gartner hype cycle. So a lot of hype is happening now. And when you look at the Gartner hype cycle, there is a technology trigger on these new platforms, and there is a inflated expectation. When you go to the conferences, you see a lot of these products in the exhibition area, and sometimes it wins. There is a tough or disappointment. Some product will go down in the course of time, and some get the enlightenment and start developing. So it is always good to have some kind of assessment. There's some that is based on the uh, whenever the new technology is coming into the market, it's challenging to adopt it. And you should look at the randomized clinical trials. And definitely a combination of automation and AI is going to come in a big way in IVF clinics. And maybe in the future, the role of clinical embryologist may change. And we can see a lot of standardization and a lot of precision medicine, and with the better efficiency and accessibility. And also we are seeing do-it-yourself IVF cycles based on the democratizing IVF, for like a patient doesn't have to come much to the clinic, using the science, medicine, and engineering, or and also involving venture capital to help build the families. So that's the future. Thank you very much.